Hey, welcome to Patho, Chapter 8, Skin Disorders. The skin is the largest organ of the body. It plays a significant role in the function of the body physically and how we're perceived in society. So women versus men, if they have scars, and how they look. Most importantly, the skin provides us the first line of defense against invasion by any microorganism or foreign material. The sebaceous glands produce sebum, which is acidic, and it helps to kill or inhibit bacterial growth. The resident flora of the skin is a deterrent to invading organisms. The skin helps prevent excessive fluid loss. It helps control body temperature using two mechanisms, cutaneous vasodilation to increase our peripheral blood flow and increase secretion and evaporation of sweat, both of which have a cooling effect on the body. And then sensory perception by the skin is a defense against environmental hazards as a learning tool and as a means of communicating emotions. The skin is our mechanism for synthesizing and activating vitamin D on exposure to small amounts of ultraviolet light. The skin is composed of two layers, the epidermis and the underlying dermis, and the associated appendages such as hair follicles and glands. The epidermis has 5 layers that vary in thickness. There are no blood vessels or nerves in the epidermis. Nutrients and fluid diffuse into it from the blood vessels located in the dermis. The dermis is a thick layer of connective tissue that varies in thickness over the body and lies below the epidermis, and it includes elastic and collagen fibers. These elastic and collagen fibers help provide both flexibility and strength in the skin and support for the nerves and blood vessels passing through the dermis. Many sensory receptors for pressure or texture, pain, heat, and cold are found in the dermis. Beneath the dermis is the subcutaneous tissue or the hypodermis. This consists of connective tissue, fat cells, macrophages, fibroblasts, blood vessels, nerves, and the base of many of the appendages. So this slide shows you a picture of each of those layers, the epidermis, the dermis, and the fat layer. Just take a good look at it and look and see what's there just so you can get an idea of it. There are 5 basic layers of the epidermis that vary in thickness. Keratin is a protein found in the skin and the nails that prevent loss of body fluid through the skin and entry of excessive water into the body, like when you're swimming. The amount of melanin or dark pigment produced by these cells determines the skin color. Melanin production depends on multiple genes as well as environmental factors such as sun exposure. Dark-skinned people rarely develop skin cancer as a result of ultraviolet light exposure because of increased melanin in the skin, which acts as a protection from the sun's rays. Albinism is a congenital disorder in which the body lacks production of melanin. A person with this trait has white skin and hair and lacks pigment in the iris of the eye. This individual must avoid exposure to the sun. Melasma or chloasma refers to patches of darker skin, sometimes on the face, that develop during pregnancy. An additional pigment keratin gives a yellow color to the skin. The stratum basal is the innermost layer of the epidermis. New squamous epithelial cells form here by mitosis in the stratum basal. The stratum spinosum cells are connected by desmosomes. This is the layer located above or outward of the stratum basal. It's a spiny layer. This layer is composed of irregularly shaped shells with intracellular connections called desmosomes. These cells are rich in RNA and capable of contributing to protein synthesis required to produce keratin. The stratum granulosum. This granular layer is where the process of surface keratin formation begins. Although there is important biochemical activity occurring in this layer, generally the cells at this stage, called keratinocytes, are starting to die and break down, making this layer sometimes hard to identify as a distinct layer of the epidermis. The stratum lucidum. This is a clear layer. This layer is composed of degenerating keratinocytes that are flattened, closely packed with indistinct cell margins. The cells are filled with eledin, which is then transformed into keratin. This layer is usually not found in thin skin, but is apparent in thicker skin like the soles of the feet. The stratum corneum. This is the outermost layer of the epidermis. It is primarily composed of flat, dead cells that are constantly being shred and replaced from the underlying layers. The interior of these cells is filled with a dense network of keratin fibers formed from the eledin, making them a strong, waterproof barrier. The dermis is a thick layer of connective tissue varying in thickness over the body that lies below the epidermis and includes elastic and collagen fibers. The elastic and collagen fibers provide flexibility and strength in the skin and support for the nerves and the blood vessels passing through the dermis. Many sensory receptors for pressure, texture, pain, heat, or cold are found in the dermis. Embedded in the skin are the appendages or accessory structures such as the hair follicles, sweat and sebaceous glands, and nails. Each hair follicle has smooth muscle attached to it, the erector pili, that is controlled by the sympathetic nerves. These muscles are stimulated by emotion or exposure to cold, causing the hairs to stand upright on one end, creating small elevations on the skin known as goosebumps. Sebaceous glands may be associated with hair follicles or may open directly onto the skin. They produce oily secretions, sebum, that keeps the hair and skin soft and hinders fluid loss from the skin. Secretions of sebum increase at puberty under the influence of the sex hormones. There are two types of sweat glands. Eccrine or merocrine glands are located all over the body and secrete sweat through pores onto the skin in response to increased heat or emotional stress under sympathetic nervous system control. Apocrine sweat glands are located in the axillae, the scalp, the face, and external genitalia, and also the ducts of these glands open into the hair follicles. The secretion is odorless when formed, but the bacterial action by normal flora on the constituents of sweat often cause odors to develop. Beneath the dermis is the subcutaneous tissue, or the hypodermis, which consists of connective tissue, fat cells, macrophages, fibroblasts, blood vessels, nerves, and also the base of many of the appendages. The stratum basale is the innermost layer of the epidermis. Mitotic activity happens here. New squamous epithelial cells form by mitosis. The stratum spinosum cells are connected by desmosomes. Protein synthesis takes place here. This is the spiny layer located above or outward of the stratum basal. This layer is composed of irregularly shaped cells with intercellular connections called desmosomes. These cells are rich in RNA and capable of contributing to protein synthesis required to produce keratin. The stratum granulosum, this is where keratin formation begins. This is the granular layer, and this is where the process of surface keratin formation begins. Although there is important biochemical activity occurring in this layer, the cells at this stage, called keratinocytes, are starting to die and break down, making this layer sometimes hard to identify as a distinct layer of the epidermis. And then the stratus lucidum, which is the clear layer. This is composed of the degenerating keratinocytes that are flattened, closely packed within distinct cell margins. The cells are filled with eledin, which is later transformed to keratin. This layer is usually not found in the thin skin, but is apparent in thicker skin on the soles of the feet. And then the stratum corneum. This is the waterproofing barrier. This is the outermost layer of the epidermis, and it is primarily composed of flat, dead cells that are constantly being shred and replaced from the underlying layers. The interior of these cells is filled with a dense network of keratin fibers formed from the eledin, making them a strong waterproof barrier. A complete mix of resident flora is present on the skin. Components differ in various body areas. I would know that. Microbes residing under the fingernails can infect and cause inflammation. It can cause lesions or breaks in the skin, especially if one scratches the skin. Microbes, primarily bacteria and fungi, are also present deep in the hair follicles and the glands of the skin and may be a source of opportunistic infection if there is an injury such as a burn or other inflammatory lesion. Infection may spread systemically from the skin lesions. Skin is prone to damage. Skin damage can also occur as a result of toxins produced by opportunistic microorganisms. A change as simple as the drying of the skin that occurs in the winter can cause conditions like surface rashes. Systemic disorders additionally may affect the skin. The skin changes with aging, loses elasticity, thins, and we see a loss of subcutaneous tissue. When large areas of the skin are damaged, appendages can be lost. Function can be impaired, and fibrous scar tissue forms, often restricting joint mobility. Skin lesions may be caused by systemic disorders such as liver disease, systemic infections such as chickenpox, or allergies to ingested food or drugs, as well as localized factors like exposure to toxins. Characteristics of skin lesions are helpful in making a diagnosis. The location, the length of time the lesion has been present, and any changes occurring over time are important. Physical appearance, including color, elevation, texture, any type of exudate, the presence of pain or pruritus, itching are also important considerations. Some lesions, such as tumors, are usually neither painful nor pruritic and therefore may not be noticed. Some common skin lesions here. A macule is going to be a small, flat, circumscribed lesion of a different color than the normal skin. Papule is going to be small, firm, elevated lesion. Nodule is a palpable, elevated lesion, and it varies in size. Pustule is elevated erythematous lesion, usually containing some sort of purulent exudate. So in the pictures, you can see the descriptions as well. A vesicle is an elevated thin wall lesion containing clear fluid like a blister. A plaque is a large, slightly elevated lesion with a flat surface, often topped by a scale. Ulcer, this is a cavity with loss of tissue from the epidermis and the dermis, often weeping or bleeding. And a fissure, which is a small, deep, linear crack or a tear in the skin. So again, these are just descriptions of those different types of injuries that you should be familiar with. And some other pictures for you to look at. Pruritus is associated with allergic responses, chemical irritation because of insect bites, or infestations by parasites such as scabies mites. Release of histamine in a hypersensitivity response causes marked pruritus. Pruritus may also result from mild stimulation of pain receptors by irritants. Scratching a pruritic area usually increases inflammation and may lead to a secondary infection. Infection results from breaking the skin barrier, which allows the microbes on the fingers or under the nails or on the surrounding skin to invade the area. When we're diagnosing foreskin lesions, we look at cultures and staining. We look at biopsies for malignant changes, blood tests, which can help determine certain conditions caused by allergy or abnormal immune responses, and skin testing or using a patch or scratch method if we think there's some sort of allergy. Pruritus can be treated with antihistamines or corticosteroids. That's about as far into that as what I'm going to go. Burns, these cause an acute inflammatory response. So now we're going to talk about skin inflammatory disorders. Contact dermatitis caused by exposure to an allergen or direct chemical or mechanical irritation on the skin. So allergic dermatitis can result from exposure of any multitude of substances, metals, cosmetics, soaps, chemicals, and plant. Direct chemical irritation does not involve an immune response, but is an inflammatory response caused by direct exposure to substances such as soap, cleaning materials, acids, or insecticides. Once the irritant is removed, the treatment is usually effective. Sensitization occurs on first exposure, type 4, cell-mediated hypersensitivity. On subsequent exposures, manifestations such as pruritic rash at the site for a few hours after exposure to the allergen. The location of the lesions is usually a clue to identify the allergen. For example, poison ivy may cause lesions linear on the ankles or hands, or a necklace may cause a rash around the neck. Contact dermatitis resulting from adhesive tape. Note how the location and shape of the rash indicate the causative agent. So you can see the imprint there of the tape. Typical allergic dermatitis manifests with pruritic area, erythematous reddened area, edematous swollen area, often covered with small vesicles. Manifestations of chemical irritation usually include an edematous area, erythematous area, and it may be pruritic or painful. Treatment, remove the irritant, and probably some sort of topical steroids. This is urticaria. This results from a type 1 hypersensitivity reaction, commonly caused by ingesting things like shellfish or certain fruits or drugs. Release of histamine causes manifestations that include the following: eruption of hard, raised erythematous lesions on the skin, often scattered all over the body, highly pruritic lesions. Hives can also develop in the pharyngeal mucosa and obstruct the airway, causing difficulty with breathing. Signs and symptoms would be eruption of hard, raised erythematous lesions all over the skin, highly pruritic lesions. Hives can also develop in the pharyngeal mucosa and obstruct the airway and cause difficulty with breathing. So remember, you don't need to know drugs, but here they would use over-the-counter antihistamine, steroids. Atopic dermatitis, eczema. This is a common problem in infancy and can persist into adulthood. Atopic refers to an inherited tendency towards allergic conditions. Frequently, family history includes individuals with eczema, allergic rhinitis, hay fever, and asthma, indicating a genetic component. Areas affected usually include flexor surfaces of the arms and legs, the hands and feet. In adults, manifestations include dry, scaly skin, thick, leathery patches called lichenification, and skin folds that may be moist and red. Pruritus is also common here. So here we have chronic inflammation, which results from a high level of eosinophils in the blood, and we have an increase in the IgE levels, which indicate the allergic basis for the atopic dermatitis, which is a type 1 hypersensitivity. So we have eosinophilia, which is high levels of eosinophils in the blood. Other complications include secondary infections from scratching, disseminated viral infections like herpes. It affects many areas and becomes more sensitive to many irritants of soap and certain fabrics. We'll see changes in the temperature and humidity aggravate the dermatitis and cause additional exacerbations. In infants, manifestations would include pruritic lesions. Lesions are moist, red, vesicular, and covered with crust, and it may involve areas located symmetrically on the face, neck, extensor surfaces of the arms, legs, and buttocks. We would eliminate the aggravating factors, probably some sort of steroids, antihistamines. Psoriasis, this is a chronic inflammatory skin disease affecting approximately 1 to 3% of the population. It is considered genetic in origin. Usually happens in the teen years, and they will have remission and exacerbations. Psoriatic arthritis begins with psoriasis and then progresses to the joints. Psoriasis results from the abnormal activation of the T cells and an associated increase in cytokines in affected tissue. Changes then lead to excessive proliferation of the keratinocytes and symptoms of the disease. The rate of the cellular proliferation is greatly increased, leading to thickening of the dermis and epidermis. Epidermal shedding may occur in 1 to 2 day period rather than the normal 2-week turnover period. Okay, so for psoriasis, lesions begin as a very small red papule that enlarges. A silvery plaque forms while the base remains erythematous because of inflammation and vasodilation. If the plaque is removed, small bleeding points are apparent. Lesions are commonly found on the face, scalp, elbows, and knees, and may be accompanied by an itching or burning. The fingernails may be thickened, pitted, or ridged. So just take a glance at the treatments. You're not responsible for them. Steroids, antibiotics, anti-metabolites. Next is Pemphigus. This is an autoimmune disorder that comes in mainly 2 forms, Pemphigus vulgaris and Pemphigus foliaceus. The severity of the disease varies among individuals. It's an autoimmune disorder. Here, the autoantibodies disrupt the cohesion between the epidermal cells, causing blisters to form. In Pemphigus vulgaris, the most common form, the epidermis separates above the basal layer. Blisters form initially in the oral mucosa or the scalp and then spread over the face and trunk during the ensuing months. The vesicles become large and tend to rupture, leaving large denuded areas of skin covered with crust. This can be life-threatening if extensive and lead to something called Stevens-Johnson syndrome. For Pemphigus vulgaris, manifestations include blisters in the mouth, blisters spreading to the skin, blisters that are painful but not pruritic, breathing difficulty caused by swollen mouth and throat. Here again, treatment, systemic glucocorticoids and immunosuppressants. Scleroderma may occur as a skin disorder or it can be systemic, affecting the viscera. The cause is not known, but increased collagen deposition is observed in all cases. In Scleroderma, we see increased collagen deposition in all cases. Collagen deposition in the arterioles and capillaries reduces blood flow to the skin or internal organs. The collagen deposits, inflammation, and fibrosis with decreased capillary networks develop in the skin. This can cause inflammation and fibrosis within the capillary networks, renal failure, intestinal obstruction, respiratory failure caused by distortion of the tissues. Signs and symptoms include hard, shiny, tight, immovable areas of skin, fingertips that are narrow and short, Raynaud phenomenon may be present, further predisposing the individual to ulceration and atrophy in the fingers. Facial expression is lost as skin tightens, and movement of the mouth and eyes can be impaired. The cutaneous form also affects microcirculation of various organs, eventually causing renal failure, intestinal obstruction, respiratory failure as a result of pulmonary hypertension. Medications vary, and they would be based on the specific manifestations. On Scleroderma, this is showing the facial expression, how that's lost and the skin tightens, and movement of the mouth and eyes is sometimes impaired. Dupuytren's contracture is a slowly developing hand deformity that includes development of knots and tissue under the skin on the palms of the hand. Dupuytren's contracture is progressive hand deformity. The cause is unknown. Knots of tissue develop under the skin of the palms, and eventually the fingers are pulled into this bent position. So treatment for this, stretching, steroids, radiation, surgery. Again, you're not responsible for that. Infections occur frequently in the skin and may be caused by bacteria, viruses, fungi, or other types of microorganisms and parasites. Pathogens or other opportunistic microbes can penetrate the skin through minor abrasions or cuts, as well as through inflamed areas. It's essential to culture the exudate for serious infections to identify the causative organism and determine the appropriate treatment. Bacterial infections are common. They may be primary, caused by resident flora, or secondary, developing in wounds or pruritic lesions. Deeper infections can cause the formation of a mass of pus in the tissue, which is referred to as an abscess. Cellulitis or erysipelas is an infection of the dermis and subcutaneous tissue, usually arising secondary to an injury, a furuncle boil, or an ulcer. The causative agent is usually Staph aureus or occasionally Streptococcus. It frequently occurs in the lower trunk and legs, particularly in individuals with restricted circulation in the extremities or those who are immunocompromised. Manifestations include reddened area, edema or swelling, pain, and red streaks running along the lymph vessels proximal to the infected area. Again, manifestations include reddened area, edema, pain, red streaks along the lymph vessels proximal to the infected area. A furuncle or a boil is an infection usually caused by Staph aureus. It begins in a hair follicle, folliculitis, and spreads to the surrounding dermis. Common locations are the face, neck, and back. Manifestations include a firm red lesion, painful nodule that develops into a large painful mass called an abscess. Abscesses produce large amounts of purulent or exudate and pus. composed of leukocytes, cellular debris from dead blood cells, and bacteria, and a thin, protein-rich fluid compartment. Squeezing boils can also result in spread of infection through auto-inoculation, transfer of the microbes from one site of infection on the body to another site, most likely by the fingers. Cellulitis can develop in another spot, or this can cause the bacteria to go into the abscess deeper into the dermis or into the subcutaneous tissue. Compression of furuncles in the nasal area can lead to thrombi or infection that spreads to the brain if the infected material reaches the cavernous sinus. Signs and symptoms of the furuncle include firm red lesion, painful nodule that develops into a large painful mass called an abscess, and it produces this large amount of purulent exudate. Carbuncles are a collection of furuncles that coalesce into form one large infected mass, which may drain through several sinuses and develop into a single large abscess. Again, we're not doing treatments for these. You would promote drainage, something for pain, and antibiotics if needed. There's a picture of one there for Uncle. Impetigo is a common infection in infants and children. It's highly contagious. Impetigo is a significant threat to neonates in the nursery with their immature or compromised immune system and close contact with potentially infected caregivers or equipment. In older children, the infection results primarily from Staph aureus, and the infection is easily spread by direct contact with hands, eating utensils, equipment, or towels. Activities involving close physical contact or contact with infected fomites can also cause rapid spread of this infection. Impetigo is commonly spread among team members of full contact sports in which mats or equipment known as fomites serve to spread the infection from one person to the next. Lesions commonly occur on the face, and manifestations include the following: small red vesicles that rapidly enlarge. Vesicles will rupture to form yellowish brown crusty masses underneath the characteristic crust. The lesion is red, moist, and exudes a honey liquid color. Additional vesicles develop around the primary site by auto-inoculation with hands, towels, or clothes. Pruritus is common, leading to scratching and further spread of the infection. Treatment is topical antibiotics, systemic administration if the lesions are bad, and then local outbreaks of infection may result. Acute necrotizing fasciitis has been termed the flesh-eating disease because of its extremely rapid tissue invasion, resulting from reduced blood supply to the tissues and secretion of protease enzymes that destroy the tissue. A mixture of aerobic and anaerobic microbes is frequently present at the site. It's a severe disease of sudden onset that spreads rapidly. Severe inflammation and tissue necrosis appear primarily as a result from the action of highly virulent strains of a gram-positive group A beta hemolytic strep. This strain also produces a toxin causing toxic shock. The superficial fascia in the subcutaneous tissue and the fascia surrounding the skeletal muscle, as well as other tissues, becomes edematous and necrotic with the occlusion of the small blood vessels, leading to gangrene. There's often a history of minor trauma or infection in the skin and subcutaneous tissue of the extremities. Manifestations include infected area appears to be markedly inflamed, very painful. Infected area rapidly increases in size. Dermal gangrene is apparent. Systemic manifestations include systemic toxicity can rapidly develop and further produce fever, tachycardia, hypotension, mental confusion and disorientation, and possible organ failure. Diagnosis is sometimes difficult as the signs and symptoms can be similar to cellulitis. It's extremely dangerous as this infection progresses very rapidly. Treatment would be things like aggressive antimicrobials, fluid replacement, excision of all infected tissue, hyperbaric chamber. Leprosy caused by the bacterium Mycobacterium leprae. According to data from WHO, the number of new cases has decreased dramatically. The organism is not highly contagious, and extended contact with the source is required for transmission of the M. leprae. The mechanism of patho is largely unknown. The disease is classified in two groups based on the treatments required. Passa bacillari, which is limited disease with fewer and less widespread lesions. Multibacillary, which in the disease it's much more widespread with significant lesions and tissue damages. Clinical signs and symptoms generally affect the skin, mucous membranes, and peripheral nerves. Manifestations typically include the following: formation of characteristic skin lesions or macules, loss of filling due to nerve damage. This damage can lead to the loss of limbs or other extremities as a result of irreparable damage or infection, and eventual tissue necrosis. Diagnosis involves skin biopsy to identify the presence of the bacterium. In addition to the diseases caused by the endemic viruses, cutaneous manifestations, diseases have been identified with other viral diseases such as Ebola, Zika, West Nile fever, chikungunya, and dengue fever. Herpes simplex virus type 1 is the most common cause of cold sores or fever blisters which occur on or near the lips. The primary infection may be asymptomatic, but the virus remains in a latent stage in the sensory nerve ganglion of the trigeminal nerve. You should know that, from which it may be reactivated, causing the skin lesion. Reoccurrence may be triggered by infections such as common cold, sun exposure, or stress. The virus is spread by direct contact with fluid from the lesion. Viral particles may present in the saliva for some weeks following healing of the lesion, and therefore you can spread the infection to others or to the fingers if there's a break in the skin. A potential complication is spread of the virus to the eyes, causing keratitis. Another complication is the herpetic whitlow, a painful infection of the finger which can pose a risk for dental personnel. So this slide has to break down the herpes simplex virus enters the human cell. The virus replicates inside the cell and spreads to adjacent cells. Viral replication causes necrosis and vesicle formation. Defenses control the infection. The virus migrates along the trigeminal nerve to the sensory ganglion and remains in the latent state. The lesion starts to heal. We see a recurrence when the herpes simplex virus is activated and it migrates back along the nerve to the mucocutaneous site. It replicates and a new lesion will develop. Signs and symptoms: reactivation is usually indicated by manifestations that include a preliminary burning or tingling sensation along the nerve and at the side of the lips, development of painful vesicles which then rupture and form a crust. Spontaneous healing occurs within 2 weeks or 3 weeks. Verrucae are caused by human papvirus. There are many types of these viruses. They are associated with a variety of diseases. Common plantar warts are caused by HPV types 1 through 4. They frequently develop in children and young adults and are annoying but relatively harmless. Plantar warts are common, occurring on the soles, with a similar variety affecting the hands or the fingers and the face. The infection spreads by viral shedding from the surface skin. Sometimes they resolve spontaneously within several years. Genital warts, HPV type 6 and 11. Manifestations include the following: a papule, which is solid, raised lesion with distinct margins. Papules will develop a rough surface, white or tan in color, and often multiple. Plantar warts on the sole of the foot. Fungal infections or mycoses are diagnosed from scrapings of the skin processed with potassium hydroxide to extenuate the spores and the hyphae or the filaments of the fungal growth, which then becomes fluorescent in the ultraviolet light. Microscopic exams and culturing can also be used to aid in identification. Fungal infections, most are superficial. Candida infection is associated with diabetes, but it may spread systemically in an immunocompromised patient. Tinea may cause several types of superficial skin infections, dermatophytosis or ringworm, depending on the area of the body affected. Tinea capitis is an infection of the scalp that is common in school-aged children. I would be able to tell the difference between these words. What do they mean and what do they look like? So with tinea capitis, we have infection of the scalp, common in school-aged children. Erythema may be apparent. With tinea corpus, we have infection of the body, particularly non-hairy parts. A round lesion with a clear center may be present, like a ringworm. The pruritus may be present, and we use topical antifungal medications here. This is a picture of the tinea capitis. Tinea corporis is a fungal infection of the body, especially the non-hairy parts. Signs and symptoms. Manifestations include the following: round erythematous rings of vesicles or papules with clear centers. Ringworm appear scattered all over the body. Pruritus or a burning sensation may be present. Secondary bacterial infections are common, adding to the inflammation and necrosis. Tinea eugeum or onychomycosis is an infection of the nails, particularly the toenails. Infection begins at the tip of one or two nails, with the nail turning first white and then brown. The nail thickens and cracks, and the infection tends to spread to the other nails. Tinea pedis or athlete's foot involves the feet, particularly the toes, either trichophyton, mentagrophytes, or trichophyton rubrum is the usual causative organism. This condition may be associated with swimming pools and gymnasiums. The manifestations include skin between the toes becomes inflamed and macerated, painful and pruritic. Fissures appear. The feet may have a foul odor. Discuss breaking the cycle of infection in this parasitic disease. Note that this infection is highly communicable in any setting and does not respect social status. Scabies is the result of an invasion by a mite, Sarcopetes scabii. The mite burrows into the epidermis, laying eggs over a period of several weeks. The male dies after fertilizing the female, and the female dies after laying the eggs. The larvae emerging from the eggs migrate to the skin surface and burrow into the skin looking for nutrients. As larvae mature into adults, the cycle is repeated. Manifestations of scabies include burrows appear on the skin as tiny light brown lines. Small vesicles are often apparent. Erythema, inflammation, and pruritus caused by damage done to the skin by the burrowing and the presence of the mite. Fecal matter in the burrow. Common sites include areas between the fingers, the wrist, the inner surfaces of the elbow, and the waistline. Pediculosis lice can take three forms in humans. Pediculosis humanus corporis is the body lice. Pediculus pubis is the pubic lice. And Pediculus humanus capitis is head lice or cooties. Lice are small parasites that feed off of human blood. They cannot survive long without the human host. Female lice lay eggs on the hair shafts, cementing the egg firmly to the hair, close to the scalp. The egg or the nit appears as a small whitish shell attached to the hair. After hatching, the louse bites the human host, sucking blood for its survival. Manifestations include a macule or a papule forms. The macule is highly pruritic due to the mite saliva. The excoriations that result from scratching and the visible nits provide evidence of infestation. The adult lice are usually not visible. Manifestations include a macule or a papule forms. The macule is highly pruritic owing to the mite saliva. Excoriations that result from the scratching and the visible nits provide evidence of infestation, and the adult lice usually are not visible. Female lice lay eggs on hair shafts, cementing the egg firmly to the hair close to the scalp. The egg or the nit appears as a small whitish shell attached to a hair. After hatching, the louse bites the human host, sucking blood for its survival. Manifestations include the following: a macule or a papule forms. The macule is highly pruritic due to the mite saliva. Excoriations that result from scratching and the visible nits provide evidence of infestation, and the adult lice usually are not visible. Skin tumors. Keratosis are benign lesions that are usually associated with aging or skin damage. Seborrheic keratosis result from proliferation of basal cells leading to an oval elevation that may be smooth or rough and is often dark in color. It is found on the face or the upper trunk. Actinic keratosis occurs on the skin exposed to ultraviolet radiation and commonly arises in fair-skinned people. The lesion appears as a pigmented scaly patch. Actinic keratosis may develop into squamous cell carcinoma. Warning signs of cancer include sores that do not heal, changes in shape, size, color, or texture of a lesion, especially an expanding irregular circumference or surface, new moles or odd-shaped lesions that develop, a skin lesion that bleeds repeatedly, oozes fluid, or itches. Guidelines to reduce skin cancers include reducing sun exposure at midday and early afternoon, covering up with clothing, staying in the shade, wearing broad-brimmed hats to protect the face and the neck, applying sunscreen or sunblock, protecting infants and children from exposure and sun damage to the skin. Skin cancer is easy to detect when identified in the early stages and should have a good prognosis. Squamous cell carcinoma is painless, and malignant tumors of the epidermis, sun exposure is a major contributing factor. Lesions are found most frequently on exposed areas of the skin, such as the face and the neck. Smokers will also have a higher incidence of squamous cell carcinoma in the lower lip region and mucous membranes of the mouth. Scar tissue is a source of carcinoma, especially in the African American population. The invasive type of squamous cell carcinoma comes from pre-malignant conditions such as leukoplasm. The invasive type of squamous cell carcinoma arises from pre-malignant conditions such as leukoplasm. The manifestations of this carcinoma include the following: development of a scaly, slightly elevated reddish lesion, irregular border around the lesion, central ulceration. The tumor grows relatively slow in all directions, invading surrounding tissue and then spreads into the regional lymph nodes. Malignant melanoma is a serious form of skin cancer that develops from melanocytes and is increasing in incidence. Development of malignant melanoma depends on genetic factors, exposure to ultraviolet radiation, and hormonal influences. Melanomas arise from melanocytes in the basal layer of the epidermis or a nevus mole or a collection of melanocytes. Nevi that grow, change shape, color, size, or texture, or bleed are suspected of malignancy. Malignant melanomas often appear as black or brown lesions. Some may even appear pink, tan, or white with an irregular border. These tumors typically develop on the chest or back in men and on the legs in women. However, the neck and face are other common sites. Melanomas grow quickly and metastasize quickly to regional lymph nodes and then to other organs, leading to a poor prognosis in many cases. This is a picture of the squamous cell carcinoma from a sun-exposed ear. Melanoma is suspected in any nevus that shows change in appearance, change in border, change in color, change in diameter. You should know this. Nevi that grow, change shape, color, size, or texture, or bleed are suspected of malignancy. Melanoma, which means black tumor, is the most dangerous type of skin cancer. It grows quickly and has the ability to spread to any organ. Melanoma comes from skin cells called melanocytes, and these cells produce melanin, the dark pigment that gives the skin its color. Again, most of these are going to be black or brown, but some are pink, red, purple, or skin colored. Kaposi's sarcoma. This formerly rare type of skin cancer has come to prominence because of its association with HIV. The disease is also endemic in Africa, where it affects younger individuals. In immunosuppressed patients, Kaposi's sarcoma is common and may affect the viscera as well as the skin. Herpes virus 8 forms part of the etiology of these tumors. The malignant cells arise from the endothelium in the small blood vessels. Multiple skin lesions appear as purplish macules, often on the face, scalp, oral mucosa, or lower extremities. As the macules develop, manifestations include the following: non-pruritic lesions, non-painful. Lesions progress to form large, irregularly shaped plaques or nodules, which may be dark in color, purplish or brownish. In immunocompromised patients, lesions develop rapidly over the upper body and may become painful. That concludes Chapter 8.